In North East North Cumbria, maternity services have been on a real journey to digitise our maternity records. That means now that all 8 maternity providers share one single electronic record, and that's been transformational in enabling us to see patient records no matter where a woman accesses her care, whether that be Northumberland or Middlesbrough. That has been transformational for us, but we know that it's left some of our healthcare colleagues behind. It's created barriers to accessing that information where we use a maternity specific system and they use their own primary care specific systems, for example. So we've developed a maternity pregnancy data set which will be available in the Great North Care record. Women won't need to tell their story again. There will be the relevant information that the clinician needs that they can find at a click of a button so that they can provide safe care in an efficient way.
So the development of integration between our North East North Cumbria maternity electronic patient record and our North East North Cumbria shared care record, the Great North Care record, was very early on identified as a priority by our partners that work together on the LMNS digital programme. And one of the key priorities that was identified was making sure that the right information was available in the right place at the right time. So we worked together with the Great North Care record team to line up the right approach, to line up clinical input, to make sure that we were co-producing a service that was safety-led and a design that really met the needs of staff and women and families that use services in order to provide the best possible care across North East and North Cumbria.
So maternity data from Badgernet is presented in the Great North Care record format that you are used to using in your day-to-day care. It's just that you will now see additional information coming from maternity services. So maternity data will be available in a quick and easy to use format.
When different organisations know their story, they don't have to keep repeating their story. It can be quite time-consuming and stressful to keep repeating and repeating, whether it's if their information is available with different systems, it avoids that.
General practice, as I'm sure you know, is the first port of call for everything. And even during a woman's pregnancy and maternity journey, you will find that they will first come into primary care. Not having access to information obviously can lead to kind of patient risk and harm. And I think having that summary of information, understanding what's happening, completes the pregnancy record certainly. But it also helps in kind of that joined up care between primary and secondary care and continuity. And that is so key in certainly delivering care and making sure that you have safe outcomes for both mum and baby.
The thing about maternity information historically is it's always been a silo. In other words, the information hasn't actually been available to me. When I've had somebody who's pregnant in front of me in the emergency department, I've been heavily reliant on the maternity services to get that information. What this adds is just an extra nuance in the care. I'll be able to access a summary of the pregnancy information for this person, whether they're currently pregnant or whether they're now in the postnatal period. It's additional information to help to care, which was never available before. In my field, in emergency medicine, we unfortunately occasionally get people who are less able to communicate, whether they're under the influence of drugs, alcohol, or unconscious through injury, and therefore I have to access other sources of information other than the patient to be able to look after them properly. So I might not even know that this person is pregnant in front of me, but as soon as I open up the record, I'll be able to see they're pregnant. That's additional information I never had before that allows me to care for this person better.
Information sharing is key. I sit on the serious incident panel and I have seen how many times patients come to harm just simply for a lack of sharing of information.
Our motto is to be the best at getting better, and that means working collaboratively to improve the way we deliver services and also constantly looking at improving the digital and data tools that we use to support those services. The Great North Care Record maternity project is the beginning, the data set is a starting point, and we will work together in collaboration with staff and service users to refine and improve over time.